Hey there, this is Dr. Evan Osar, founder of Fitness Education Seminars and developer of the Integrative Movement System. Welcome to this edition of Fitness Insider, Part 3 of helping your clients solve their chronic neck tension. Recall that in Part 1, the most important thing that you can do as a fitness professional is help your clients breathe better. The more that they're able to develop three-dimensional breathing, the more optimal they'll use their diaphragm and intercostal muscles, and they'll stop using the scalenes, the SCM, and the pec minor, some of those accessory muscles of respiration. Part 2, we talked about the proper alignment of the head and neck and how to restore the deep muscles to help restore the natural cervical lordosis to help a lot of that forward head posture. Now in Part 3, we want to incorporate alignment, breathing into the fundamental movement patterns, especially pushing and pulling, because a lot of our clients are driving neck problems by their exercise, especially resistance exercise and even repetitive exercises like running and or biking, because they're not able to stabilize the scapula on the thorax where it belongs down here, so they start to use the neck as a point and anchor for stability when they start to do heavier weights or higher loads or they get fatigued. And that's why it's so important to start to palpate your clients' necks, especially around the levator scapula and upper rhomboids, where they really start to lock that scapula up into the upper thorax and into their neck for stabilization versus having it stabilize around the thorax. And that's why we teach our clients to wrap that scapula around the thorax and stabilize here versus having it up here. They don't pull down and back. We teach them how to wrap the scapula. So we want to incorporate that into their exercise patterns. So I'm going to demonstrate a dumbbell row and where the optimal neck position should be and scapular position is, how you can monitor your clients to make sure that they're not getting into their neck as they're doing their upper body patterns. So first thing I want to do is assume the proper position for a bent over row. So I'm going to stabilize my arm against the wall. I want to get a nice long head and neck position, so maintain the cervical lordosis. Stay long through the back of the neck. I keep the rib cage connected down to the pelvis. And again, my thoracolpelvic canister is aligned, my head and neck are aligned. Then I stabilize my arm. Then I get my dumbbell, and now I'm going to row up and come back down and control it. My head, neck, trunk should not change position during my dumbbell row. And what you want to do with your clients is check their cervical spine. So you want to make sure that it stays soft, relatively soft through their neck, and they're not doing that to stabilize their scapula, that they're able to stabilize by staying open through the front of the shoulder, wrapping that scapula, the neck stays long and not increase in tension as they're doing their dumbbell row. So again, the scapula stays stable on the thorax where it belongs, the head and neck stay aligned and controlled, the thoracolpelvic canister stays stabilized through the entire pattern. And that's how you get your clients to start to improve range of motion, decrease chronic tension, and help improve overall function by teaching them the principles of the integrative movement system. Align, breathe, and control during all their fundamental movement patterns. So it doesn't matter if they're doing a rowing pattern, if they're doing a pushing pattern, whether it's going overhead like a vertical press or pull, or if they're doing horizontal patterns. You want to stabilize the scapula with a neutral alignment, head, neck, and the thoracolpelvic canister. So I hope that helped you and helped you serve your clients that have chronic neck problems, because when you incorporate the principles of the integrated movement system, your clients will feel better, they'll look better, and they'll move better. And that's how you become the solution that your clients need, want, and will seek out. This is Dr. Evan Osar with Fitness Insider. Hope you enjoy this 3-part series. We'll catch you next time.